Would you like to know how you can avoid losing about 25% of your bone jaw mass after tooth extraction? I'm Dr. Rima, a consultant periodontist and implantologist here at Dr. Joy Dental Clinic, and I can assist you in getting a dental implant, which can help you prevent this bone loss. In order to understand why this bone loss happens, we need to know that the root of the tooth is actually stimulating the bone mass and the bone volume due to the normal masticatory functions. When we end up losing this tooth, there isn't any more stimulation for this jaw bone, and we end up losing the function and the mass of the bone. When we place a dental implant, which is a small surgical procedure, the implant is placed in the jawbone, and once it heals, then it can stimulate this normal masticatory function to preserve the jawbone, which in order will help preserving your facial structures and your oral health. If you would like to know more about this procedure, please come visit us here at Dr. Joy Dental Clinic.